Okay, so I'd like to introduce our panel members for our panel discussion. Our overarching question: how do we build partnerships in One Health across university? But we have a number of prompts that we'll use to facilitate discussion. And our panel members include Parker Antin, the Associate Vice President for Research in the Division of Agricultural Life and Veterinary Sciences and Cooperative Extension, and also Associate Dean for Research in the College of Agriculture and Life Sciences. Nathan Cherrington, who's an Associate Dean for Research and Director of the Southwest Environmental Health Sciences Center, which is one of our NIH centers here at the University of Arizona, and the Director for the Center of Toxicology. We have Melanie Hingle, Associate Professor in the School of Nutritional Sciences and Wellness in the College of Agriculture and Life Sciences. Kelly Reynolds, who's the Professor and Chair of the Department of Community, Environment, and Policy, and the Director of the Environment Exposure Science and Risk Assessment Center. And Kate Worthing, who's an Assistant Professor of Practice, One Health and One World Clinical Skills Instructor in the College of Veterinary Medicine. So with that, I will read the prompts for our panel since they can't see it from their seats. And our first prompt is: the field of One Health encompasses a broad array of problems at the intersection of human health, animal health, and environmental health. How should we focus and build our efforts in One Health at the University of Arizona while avoiding the pitfalls of calling everything One Health?
We started that in.
First is technical training for the professors who don't know how to turn the microphones on. I don't think names really matter. I don't, environmental health, animal health, it doesn't matter. It's all the same thing. And first of all, let me just say, I appreciate the opportunity to be part of this, and not only just to be recognized, but the support that we've received at the University of Arizona is outstanding. Just for some perspective, in terms of environmental health, the University of Arizona has more than 1.5% of the entire budget of the National Institute of Environmental Health Sciences, because of our success here at Arizona. It's been supported, and it's a great opportunity. So calling things one thing versus another, I don't think it really matters. I think everybody collaborates and works together on a united front.
Jump in. Thanks. I couldn't agree more. Something I heard today over and over is community engagement, how all of us are engaged deeply with the community and work in partnership with the community. And I am a community scholar as well. I think this is the key here. So it's not necessarily the moniker of One Health, but the quality of the relationships that we build with our colleagues in the community who are not necessarily here at the University of Arizona. And I think that's a theme for sure I heard across all of this. So I would encourage us to do more of that. One example that Paul Brierly spoke of this morning was a public-private partnership that he's the director of in Yuma. And I think this is another way that we can advance our research here in this area and at the same time impact the community. So public-private partnerships, also a good way to go. On the top.
I'm not sure if I passed that test, but it's working now. I agree with what you said about community. I think as a new college, particularly for the College of Veterinary Medicine, we see the opportunity starting in a land-grant university to root our research in community needs. And so by addressing community needs, the community is made of animals, humans, and they live in an environment. So thinking about community needs is really a good way to address that. But I would also say, from my personal perspective as a researcher coming here fairly recently, when you're talking about collaborations with other potential One Health collaborators, is actually to be explicit about what you or your college's view about One Health is and what your perspective is, because that's when you find that other people's perspectives are quite different, and there's strength in that diversity, but you actually do need to be sure that you're explicit about expressing what your needs and wants are so that you're not kind of working in tandem or in conflict. So that's what I would say.
And I would just add that One Health is really just a framework to bring us together, like we've gathered together today. And I'm thinking about Amanda Wilson's Venn diagram and how she was out here and she says, I'm trying to get to the center, but we all don't have to be at the center. That's what this collaborative relationship building is about. And I think some of the places where we can really draw on our strengths at this university is the unique Arizona advantages. And if you think about, our climate, our conditions of drought, our agricultural industry, that Yuma produces 80% of the leafy greens for the entire nation in the winter time. The pesticide registry that Melissa Furlong talked about. I mean, we have so many Arizona unique benefits here, and I think that's where we can start to build together under this One Health framework. But it's just a framework, because it's true. When we started trying to gather people around One Health across campus, people did say, well, everyone's One Health and therefore no one's One Health. So what does that really mean? But that's what we're defining today. And I think we can move forward with specific objectives and the teams that we can bring together from what we're hearing today to really build that and define that for what it means for our institution. And then how we can also educate. We need to get better at risk communication. We need to get better at informing our politicians about the needs of the state and the needs of a One Health framework. And I know that a lot of that initiative is taking place. Dan Dirksen and Frank von Hippel have been talking to our legislatures and other people as well. But that's really where we need to continue to grow this framework and the recognition of what we can do here. That is, again, Arizona uniqueness.
At this point, I think I need the question repeated. No, I understand what it is. Yeah. So this is the issue with One Health, right? If you're too broad, it's everything and it's nothing. It doesn't have really anything to it. It's almost like Jell-O, right? And how do we manage that when we have a diverse land grant institution, as we've talked about, a very highly unusual one with a full medical center on campus, which is really unusual, and we have the full breadth of the land grant institution. And it's challenging. And I think one way we might be able to think about it is to think about what outcomes would we like to see in 5 years? What would we like to see? How would we like, if we had success, what would it look like? And then you can start working back from that, because ultimately you have to get to concrete programs and activities. And that's the challenge when it's everywhere, when we're talking hundreds and hundreds of faculty. So perhaps identifying what that future success would look like would allow us to work backwards.
Great, thank you for those great answers. Do we have a follow-up question or comment from the audience from this first prompt? Okay, we can move to our next prompt. So how do we build One Health research relationships across campus? There is some of you have already addressed this to some extent, but let's go ahead and see if there's more comments on this. How do we build One Health research relationships across campus?
I'm just going to jump in. I think one way is we're already seeing this on campus. We have mechanisms for seed grants for faculty to work together from different colleges and different initiatives. And I think the same thing could be, it probably has been, I don't know about it, been applied to One Health to bring different colleges together. And I would only add in addition to that, perhaps making a third partner, in addition to two colleges, a community partner or a community engaged partner, just to expand again the impact.
This could be at a lower level, but again, coming from this new college. So we were starting out all these partnerships, is even just things like shared research students across faculties is an excellent way to foster these partnerships across colleges and faculties, is having things like shared research students, especially where I often feel as a vet that I'm like a mole in other industries because I used to work in human medicine research, particularly where you have one student from a very different discipline going into another and having more of their project base there is really a good way to get knowledge sharing and collaboration on a lower level, but then it builds bigger projects through the things that the students are doing.
And I think too, we have a really rich working group of Associate Deans of Research across campus. So every department has a representative of Associate Dean for Research that is more familiar with the type of activities that are going on within their departments and within their colleges. So I think they could be a group to also help plan some of these initiatives to bring people together. And I remember in Kristen's talk today, she had just this list of questions. She gave the talk about the the animal shelters, and she had this list of questions at the end that we'd like to be able to answer. And I think probably some of you thought, I want to know the answer to that question. My research can inform that question. So maybe we need to start working as a group, maybe through the ADR offices, and start thinking about what are our list of questions, and then starting to identify people that can come from different disciplines to meet those challenges of finding those answers. I'll give you a job.
Thank you. I'll add it to my list. No, I actually think it's a great idea, because ultimately what Melanie's talking about, and Kate also, is that we're looking for that interdisciplinary connection that culminates in major projects and therefore impact, right? So a future outcome would be some major projects, funded projects that span our university capabilities and come together under the umbrella of One Health. Students are a remarkable glue in that way. You could imagine almost I doubt this would happen, but a GIDP that would purposely seed students around campus, and that's a great way to bring, because that forces faculty together, right? But this notion is great, and the ADRs could be a facilitator on the quote research side to say, here are our capabilities, here are ours, let's get these people together and start talking and start working on actual, pre-proposals, moving to proposals, moving to projects.
Thank you. From my perspective, the first knee-jerk reaction to what can the institution do to support more work across campus? Oh, it's always more money. Well, actually, we're really fortunate here at the University of Arizona. We have support from each of the institutional heads that can serve in that role. They already are, and so we're very fortunate. Dr. Cantwell participates with Funding Facility Corps with user fees for environmental health research. Dr. Dake supports community-based research through the CEC. We just call it the CEC, Community Engagement Corps. but each of the institutions here at the university, and every single one of your deans, is participating by kicking in money for this. So my experience is that what can the institution do? They are doing it as much as they can. So finding opportunities for us to work together is sort of our job, and that's what this is about today.
Okay, do we have any follow-up questions or comments from the audience on either of these first two prompts? Yes, please. Yes, that's a great comment about facilitating people who want to work down in Yuma. And also, many of us who work in Yuma have excellent partnerships with the hospitals and the community groups already. So there's a lot of engaged faculty. And if you would like to get into that space, those of us who already work there are also happy to help with that. Someone else had a comment or question? Yeah, Dan? Please.
Just for this group, because I looked at your research productivity over the last 10 years as part of our group, especially you sitting at this table have been incredibly successful. What are the attributes that make it so appealing to federal and state foundation funding that you've been able to apply that maybe you can share as senior mentors for our upcoming researchers in the group?
Guess I'll start. Looking at me. So I have run some large projects across campus, some very large projects that were funded nationally. And I would say the hallmark is what we're talking about, which is interdisciplinary. We've been able to make tremendous progress and impact in research because, we've heard this for decades here, that this is there are no barriers and so on, and people say that's just buzzwords, but it's really not. So I would say to young faculty is you've got to get your program going, but don't be a silo. Reach out, look for those connections, look for that connectivity, because that's what the federal agencies are looking for, and that's ultimately what creates increased impact.
Let me just give you apologize, sorry. Let me just give you some data behind that assertion. So in the past 6 years, environmental health sciences funded research went from 2.3 million to 10.5 million. Environmentally related research other than NIEHS went from 13.6 to 36.4 million, and total federal funding for environmental health research went from 17.4 to 60.9 million in the last 6 years alone. In pilot projects, we invested $1.4 million and turned that into $58 million in federal funding. So yeah, this is a legitimate topic that is that is generating interest from federal funding. So it's a recognized strength of the University of Arizona. Our environment is different. If you talk about climate change, what will a major portion, 2.1 billion people, what will their environmental health issues be in the future? You look to the desert, arid lands. And so that theme of we are already what the world will become, that is a strength that we can cash in on.
And part of my research portfolio has been really working with industry partners and health departments, thinking about how we can come together, not just around the basic research questions, but how do we apply that research, bringing in community members, bringing in industry leaders who, as an example, one of the projects we had was working with Banner Health to evaluate hygiene interventions to reduce COVID transmission or other healthcare acquired infections. And so companies like Clorox and Procter & Gamble and Georgia Pacific, these were sponsors of our research. And I think when I first started out in my career as a graduate student here at the University of Arizona back in the early 90s, and I was told, don't work with industry, your research will always be seen as biased. But I think we need to make sure we're expanding that view. And I think that has happened over the last few decades, that industry companies, even though they stand to make a profit from some of this research, they also have an interest in the products they're developing because it does help human health. And so that's part of their mission too. So being able to see some of these relationships, the partnerships, and bringing those entities together, I think is part of that holistic approach to research and making sure that research is applied in places where it can really help human health. So that's a lot of where my research is focused. And I think when I first started there, I thought about it as kind of unconventional sources of funding. So not necessarily your NIH or NSF, but where else are there pockets of money that can help drive the research I want to do? And I found a lot of that working with industry.
Yeah, I'd like to add on to that because I have a similar experience, not with industry, but with community partners and nonprofits, and who are not rolling in cash a lot of the time, but are very invested in the same exact health outcomes that we're invested in as researchers. So pairing the science with the community need has been a selling point, I think, for my proposals, especially from the NIH or even the NIH, who you think would be a little bit more science focused than the latter. So I agree with you 100%.
Great. Our next prompt is, how can the One Health program at the UA facilitate integration of Arizona priorities, for example, in the areas of water quality and conservation, food security, antimicrobial resistance, and zoonotic diseases?
Sorry, we were collaborating.
Apologies.
So seriously, we were starting a collaboration.
Do you want me to repeat your
I don't know what you just said.
Okay. So how can the One Health program at the U of A facilitate integration of Arizona priorities? And the example priorities that I listed were water quality and conservation, food security, antimicrobial resistance, and zoonotic diseases, but it could be other things.
So the question that I asked of, I forget his name. The gentleman who gave the second talk.
Mark for Hoogstreet.
Okay.
Water guy.
So there are communities who are at risk because of where they are, and there are communities at risk that are because of diseases that are more prevalent in that population. And so it's a combination of factors, and teasing out how those factors are interrelated is a very complex. I mean, the reason they call them complex diseases is because it's not easy, and it'll take us another, if I say 50 years, but it's a complicated issue. But each of those is related to Arizona priorities. The desert environment, arid land environment, the people who live there, and the unique environment that we have that creates the circumstances that we live in. So I see this as a thing that will continue to be a strength of the University of Arizona for forever.
And just to add on to that, disease is obviously a complex mixture of our physical and our social and our biological factors that all come into play. And I think part of the discussion today is thinking about the new models of approaching disease prevention or, addressing disease that's already occurred. And some of the things we haven't heard about too much today, but Nathan sort of touched on it just now, are the social determinants of health and environmental justice. And that's a strength I think we have at this university because of a lot of our community engagements, our unique populations here, being a Hispanic serving institution, having a lot of Native American populations in the state. These are the kinds of issues that we do need to work together to build towards finding solutions to some of those big problems. So I think we heard a bit today about new modeling approaches, new analytical approaches. I don't think we heard anybody talk about artificial intelligence, but that's another thing in there. There's people on campus that are working in that field too. How do we automate decision-making to improve health, to improve One Health? So I think there's so much more that we could bring to the table here, but we have all of those players here at this university now. So I think the hardest part is this next step. And I would throw it almost back on the audience. Who did you identify today that you could connect with, that you'll start the next conversation with? I looked around a little bit at lunch, and the people that I knew some of them were sitting in their same silos. And so this meeting is really about mixing up a little bit, and how do we force ourselves to do that? And I kind of wondering who in the audience here has some ideas on how we might do that. I'm going to be calling some of you tomorrow, and I'm going to call you tomorrow because there's things I've thought about that you mentioned. So, think about who can you call next?
So the areas you mentioned are a bit more concrete than One Health, which is great. And it's possible we could take these kinds of questions and actually move forward, perhaps with the ADR group originally, but with others, to say, here's a place where we actually could build program. So how do we put a workshop together? How do we integrate these together? How do we have an output from that says, this is how we could move forward to create greater impact in that area, to bring faculty together around it? I like the somewhat more concrete nature of those topics where you actually can make actionable progress towards some outcome.
And speaking of something concrete, I would put it back on our leadership. We speak about seed grants. That's a great way to do interdisciplinary research. So why don't we prioritize the seed grants to these Arizona priorities? So then we're getting these specific themes to do with One Health and specific calls that give out grants to interdisciplinary research on those specific themes is one way that I could see a tangible way forward of us addressing specifically those pillars and the priorities.
Great, thank you guys for those answers. Do we have a follow-up question from the audience? Okay, we can move to our next prompt. Where do you see the greatest funding opportunities for One Health research?
Well, did anybody else attend the National Academy of Sciences workshop last week? They had a 2-day virtual workshop talking about the future of environmental science and environmental health sciences. And they were, so this NIH, NIEHS, your cancer centers as well. So they were definitely talking about making sure that environmental health sciences incorporates the social determinants of health, environmental justice. I mean, it just was driven home in every talk that that's going to be another umbrella of focus. And certainly it's part of the umbrella of One Health too. So In terms of where's the funding coming from, I think it's a lot of the same old players, but in terms of what they're going to be funding, I'm seeing a bit of a shift. So curious what the other panelists think, but more of a shift to social determinants of health and environmental justice, which we all do very well at this university.
Yeah, it's a good question. I often think of how big the food bowl is in different places. Because in the College of Agriculture and Life Sciences, we are funded across a broad array of federal agencies. Ironically, NIH is our largest funder, even though we are the major USDA and NSF. And, you know, where the money is actually the National Institutes of Health relative to anyone else. The entire budget for the USDA NIFA is 1% of the NIH budget. And NSF is challenging. So when you think about growing major programs, NSF has those programs you can apply for. They can be challenging. They're generally must be multi-institutional. But NIH is where you can see, NIEHS is where you could see, you know, a tremendous ability to actually grow research, because we need the money. Money is like fuel to do the research, right? It's not the endpoint. But in order to get, where's the fuel? Well, most of the fuel is in the NIH depot. So I would suggest that we, you know, consider very strongly how we can move towards very large proposals that address NIH, not exclusively, but compare NSF to a bit, but mostly NIH.
So there was there was a lot of moaning at NIEHS a month and a half ago when the decision. So the earmark for climate change was not funneled through NIEHS, and oh no, what are we going to do now? Well, it's still coming. You know, just that it doesn't go through NIEHS, it's still NIH money, and it doesn't matter which agency. It's still earmarked for climate change. That is still worthy goal. So yeah, and I'm a little biased because we're limited. We have to have NIH. So so the Southwest Environmental Health Sciences Center is funded by NIH for NIH users, and so by definition, it's sad to say that we have to be sort of exclusive. That the One Health research is the theme of the NIEHS P30, but we have to be artificially exclusive because it has to support NIH funded researchers. But the themes are pretty identical. So we're more than happy to collaborate and participate as much as we can with pilot projects and facility core usage.
Yeah, I just to reinforce what you were talking about, partnerships with industry earlier. I had a conversation yesterday with some colleagues with a large corporation that's private, that's engaged in health, and they are now shifting their focus from disease-specific focus to also include social determinants of health, and that's sort of the new kind of corporate responsibility or corporate, social responsibility, is that view, at least in the human health sphere. So I think there is an opportunity still to, in addition to National Institutes of Health funding and USDA and NSF, to also look at those companies as partners. And according to the person we spoke with, that is what they're looking for, not to just fund research, but to help think about these big questions and help fund some of these activities that can inform what we do next.
So we only had half an hour for our panel. I wish we had 3 hours for our panel. Those are all really great answers. The last question we don't have time to go through right now, but maybe just to put it up for people to think about, is how should the University of Arizona use One Health approaches to address health disparities in vulnerable communities? Many of us are interested in really focusing in this area. So I'd like to thank our panel, really appreciate it, and we can hopefully have more discussion on this informally after our closing remarks. So for closing today's session, I'd like to invite Dr. Michael Dake to the microphone. He's our Senior Vice President for Health Sciences, and he'll close out the show for us today. Thank you.
Wow, what a tremendous symposium. I want to make sure that I thank all those who worked so hard to put it together, and to the presenters whose work discussed today is truly outstanding. Please accept the appreciation of all of us. I got the club sandwich for lunch, and in my box were some potato chips. And the title of the potato chips in my box, and maybe if you got the club sandwich, was Funky Fusion. And I was thinking there, Funky Fusion. This sounds kind of like what we're doing today. One Health, simple phrase, but represents a multifaceted concept. And I'm just going to give you a little background of first personal background, how I was first exposed to One Health, and then this journey, which is pretty compact, of how we got here today. So a little over a year ago, I first got exposed to the concept of One Health. In 2019, we went to the legislature with some proposals, and everyone told us, you know, the legislature never is going to fund anything you do. That doesn't happen. You know, we've not had that in years. And it came out that the reason kind of they weren't funding was because things were coming in broad, general brushstrokes. They weren't project driven. They weren't concrete like you were talking about. And we came with some very concrete things, and they funded us. And after that, we've had a pretty good river of funding from the legislature, which is also supporting us here today. As everyone mentioned industry and NIH and NSF, but the new economy initiatives funded by the legislature is where this thing is really getting jump-started. And so I think that it's important to recognize the legislature is also very tuned into what's going on here. So we started thinking about One Health, and the president was thinking about it, and we talked, and we said, I thought it had all the right fundamentals to be something that, excuse me, that we could certainly use at the University of Arizona to build a showcase. And so we, at that point, I got the deans together of all your colleges and Dan and others. And so we had 2 deans of medicine, public health, vet med, everyone together. It was not working. I'll just tell you straight up. I was not effective. I admit it. I couldn't really get people to get off what they wanted for their little college. This idea of the bigger whole, I wasn't successful in really selling that. And it sort of went fallow for a while. And then in December, is that when we went to Washington? In December, we went with a contingent of state legislators, 10 of them, to DC, to Arizona state legislators, to DC, to talk about what the U of A was doing and priorities, and the legislators really like to go to Washington. And this was a good opportunity to also christen, from the health sciences standpoint, the new office in DC. And Frank came to talk about One Health. And at that meeting, it came back to me, we've got to do that. This is something, we can do this. And I think we can do it in a way that the legislature will really respond to us. So we put in for the new economic initiatives and got funded. But the purpose of all this, and all of you and the panel and everyone, is to really get set for next year, when we make a big ask to the legislature. And I'm pretty confident that we've got their ear right now. And I think the timing, it's just most propitious. I think we're in really good shape for this. And so what really did it after that is I just got out of the way, you know, and sometimes being a leader, the best thing you do is just get out of the way. And Dan and Frank and others took over, and it's just gone fantastic. I couldn't be prouder of, you know, where we are today and where we're gonna go. I think they've spent a lot of work on this. They certainly know the areas more than I do. And again, how we pull all these seams together and what we focus on, that's the fun. I thought Frank's questions were, every one of them was fantastic. You know, that's the real nut of the issues, you know, how we play to Arizona's strengths. And I think you mentioned that, to really make the case to our legislators about how we can really partner with them and help solve some of these problems that are, you know, not only distinctive to the state, but there are other people who share them. And I think that would be great. I could talk a lot about unified approaches, but I think we all sort of have bought in to the collaborative nature of what we're asking each other to get involved in. I think it's something that, at least in health right now, all the simple problems have basically been solved, right? I mean, we're talking, everything we've left with are I mean, the easy problems are gone. Now we've just got tough challenges. And these tough challenges can't be solved in most cases by a single discipline. They're really going to require communities working together at varying professional levels to make it happen. I mean, the complexity, I was just thinking just the other day, because we do, obviously at the U of A, we've been very involved with COVID, as everyone knows, and over 50,000 antibody tests, over 250,000 vaccine doses administered. I'm sure many of you know, but Arizona was very unique thanks to the efforts and thanks to efforts by Cecilia and Dan and others. We're the only state in the country that had a higher vaccination rate in the rural population than in the urban population. That's incredible, and it wasn't like our urban population was way below the rest of the other states, but everywhere else in the US, urban populations or vaccine administered was much greater in urban populations, not in Arizona. Why? Because we have this network that we really can call to the front and really utilize. And basically, I think that's the advantage of when I look at One Health. I think we've got this ability to deploy so many assets out there and throughout the entire state in a statewide effort that I think we have a great chance of making a tremendous impact. So while the work that's taken place so far across the university in One Health has been making great strides, I know I'm not alone in looking forward to the much greater progress that we can make from this day forward as we consider how to pursue this higher level of interdisciplinary collaboration. And I will tell you, this has blossomed into really a top priority in the university. I mean, I'm kind of, but everyone should understand that this is a top priority with senior leadership at the university, and we can sell this at the highest level. And I'm starting to get my head around it. Most of you are way ahead of me, but I'm starting to understand where we can really have big impact, not only nationally, but globally. So today's symposium, featuring the outstanding work across the university, showed at the heart of One Health what is truly there, and how the whole will be greater than the sum of the parts as we tackle the world's most pressing problems. I want to give just final message, special shout out, kudos to Dan Dirksen. Great job, Dan. To Frank, great job. To Randy, to Melissa, to all the people who helped coordinate today's symposium. It was a great day. And a couple of years from now, we'll look back at this and say everyone was there. And we'll remember all these things that we started out thinking about, and how we made choices and how we made decisions to go in one direction or the other. But at least we all are, I think, here at the beginning of a collaborative effort that I think is going to be really impactful for the university. So thanks very much. Appreciate it.